Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana Herenque. If you're new here, if you're not, thank you for coming back. Today is Tuesday, August the 17th, and I'm joined by what's probably a familiar face at this point. This is our own Lita Gore. Lita has been following the case numbers for COVID-19 since the start of the pandemic in March of 2020. Seems a little bit crazy to say. It's been over a year now. Lita, I'm sure it feels like 10 years, but she has been following these numbers. And especially over the last few weeks, we've had to kind of resurge some of our daily or semi-daily updates on AL.com about the case numbers. And that's because they have been rising. We've been talking about this. You probably, if you are a regular reader of AL.com or just of local news in general, you have probably seen stories like this in the last few weeks. But Lita, I thought it would be helpful today to come in on this kind of new week. It's not Monday, but it's the start of a new week, and talk about what case numbers are like now. We know the last 2 weeks or so have been deadly in Alabama, most likely due to that Delta variant of COVID, but we haven't had a talk about the numbers recently on this program. So I thought it would be helpful to give people an idea of where we stand today, August 17th.
Yeah, absolutely. If you see me flipping back and forth, it's because I've got a laptop right here that I'm working on. We have seen, I would say, for the last 7 to 10 days, the daily increases, which we were seeing on a high of like 179, 185, have gone up to the 3,000 range. Sometimes it's 2 to 4,000. Usually, I think we've had a 4,000 day only when there was 2 days combined. So, and what people have to remember is when you have cases, everything doesn't happen super quickly. So you have cases that test positive, and then let's say a week later you end up in the hospital, and then 2 weeks later you may pass away. So when you see this huge trend of case numbers going up, that's why that really matters, is because it's in a pattern. And because of the Delta variant, there's a lot we don't know. A lot of it is like March 2020 when we were first dealing with this. We just don't know, when this spike will end, how quickly it will end. Hopefully soon, because I got asked the other day, can we report something besides COVID? And I said, trust me, we would love to report something besides COVID. The day I don't write it anymore will be a party. But at the same time, I think that awareness helps to, I'm hoping it makes people more careful in what they do and how they behave.
I'm looking through some of these comments here, and this is one from Tony. And Tony, we're going to get to this in a minute, but I'll go ahead and kind of give you the short version. He says, do you have cases of hospitalized that were fully vaccinated versus unvaccinated, and the kind of breakdown there? So Tony, we do have those numbers, and I'll go over them here in a second. But the second part to his question is, Lita, when these cases are reported, so these breakthrough cases that he is talking about, which if you're not familiar with that word, that just means you get COVID even though you're vaccinated. So of those breakthrough cases, we know that there are some people hospitalized that have been vaccinated. And part of Tony's question is, are we going to know, is it reported to ADPH, the type of vaccine that person received, or is it just saying that they're vaccinated?
Yeah, I have not seen that data, and as far as I know, I'm sure it is being tracked, or I would assume it is being tracked, but we don't have that data yet. And I'm going to use a Southern phrase, but bless their hearts, ADPH's data issues have continued. And I was talking to someone the other day, and I said, one of the things I think we can take away from this pandemic is our reporting of public health data has got to improve. It's just got to improve. And so, no, I don't think I have not found that data, and I've looked about everywhere I think you can look. And that may be one of those things that as time progresses, the ADPH starts releasing that data if they're not already tracking it.
Again, looking through some of these questions, and this is a good one, and it is about people who have kids in school. Lita, I know you have a kid in school. Kid is probably, she'll get mad at me for saying that, but you do have a child in school.
Yes.
And I know that a lot of our viewers, a lot of our readers do, and that they are very worried about that. So question here from a concerned parent saying, my son went to school one day and then tested positive. Are there any updates on mask in schools, and are they showing how many cases are in the schools? So, Brittany, I'm going to refer you on the question about masks in schools. There's a lot of systems who are saying that masks are required in their schools. That is a district decision, though. That's not a statewide decision. Yeah. I'm going to refer you to our Alabama Education Lab, and that editor, Ruth Smith, she will be able to give you updates there. I will tag her. If she's not watching, I'll tag her later, Brittany, so y'all can connect. But Lita, do you have an answer on if the ADPH and that dashboard is showing how many cases are in the schools?
They have not. Okay. And this is, again, it all comes back to this data issue. The schools report their numbers to the ADPH. Now, does that mean I report it today? Does that mean I report it tomorrow? Does that mean I report it next year? So that it is not 100% accurate dashboard. There were roughly, I believe so far this school year, and Ruth will be a much better source for this, but I think it was over 5,000 cases. However, what the school systems are going to point you to is, I know my child has been back in school for 6 days. Other schools have started different times. Was that something that was contracted early? Was that something that was contracted once you got to school? That is still kind of up in the air because we're still early enough in the school year, but we're not seeing the dashboard that the ADPH has that is school cases. It is not fully activated yet and being reported. And I see a lot of parents talking about how their individual schools are sending out updates. I know that's what my child's school does. I get an update every week that says, this is how many cases we have. This is students positive, blah, 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 blah. I don't think a lot of that's just kind of in the process yet. You know, it's one of these things, I think, and I know I did. I sort of took a deep breath and kind of walked away from some of that reporting and some of that work. And then now we have to get back into it, unfortunately.
Well, and one of our education experts, Trish Crane, she just jumped into the comments here. Good. To Brittany. I'm sure Trish can help you, and Trish can direct you to some of those places as well. And I believe that Trish has said here that the ADH dashboard for schools is going to go live mid-September. So give it a month, and then we will have that dashboard. Brittany, I hope that answers your question. And if not, Trish is your person there. Yeah. Question here from Leslie, and she asks about hospitalization numbers. So hospitalization numbers, this is what we've got. We've got 2,631 people hospitalized across Alabama for COVID today. Now, Leslie asks, is there a place to find hospitalization numbers broken out by county?
You know, that is a very good question. I do not know that answer, but I will find out that answer and put it in the comments. The thing with hospitalizations is, again, that is reported obviously from the hospitals. And it changes very quickly. So that the ADPH dashboard is actually retroactive. It's 1 day behind. I don't know the answer to that question. And I would tell you that I would click right over here to my friendly ADPH dashboard, but it is the slowest. I mean, it's just very slow. And so I was looking to see if I could look it up now. I'm not sure if I can because it doesn't like to load. But I will, I'll see if I can't get that information. I'll put it in the comments.
Thanks. And you, I know you've got a computer, you're looking at one, you've got another computer. So if you load that dashboard, we'll check in with you about that in a few minutes while that loads.
Multitasking here.
It takes a lot of bandwidth there to load. Now, questions also as well about this Delta variant. We know that is the primary variant that is really wreaking havoc across the country right now, wreaking havoc across Alabama right now. But Lita, there's not a way if I went and got tested for coronavirus, they would not be able to tell me when I get my test that if it was the Delta variant or not.
So it requires additional sequencing, which is not widely available. And I get asked that question, how do they know it's the Delta variant? Because and it's basically like you would do I compared it to a survey. If 20% of the people answered yes, they take that number and apply it that you would assume 20% of the general public would answer yes. So we have done enough testing to know that the Delta variant is 86, 85% of what we're seeing now. So they're applying that same theory to a general level of where we are. I want to circle back real quick to the county hospitalization thing. One of the things I would really recommend that you do, because so many of the hospitals are doing a really good job of reporting their numbers, is if, and believe it or not, the ADPH website is still loading, but if you have questions about your particular county, if you have a hospital in your county, it sounds simple, but I would follow them on Facebook, because so many of them are releasing these numbers on a daily basis. And I love getting grassroots data. I live in Huntsville. I check Huntsville Hospital every day because they release a lot of pertinent local information that may be quicker to go through the hospital as opposed to the ADPH. So follow your local hospital on Facebook. Easy tip of the day.
That is what somebody said. They said, look, some counties are working directly with the hospitals to provide those numbers. And, we have seen this, and it's almost like a template of these things that a lot of hospitals and county health departments are putting on their Facebook and their Twitter pages, and it's showing those hospitalization numbers. Now, Lita, I want to get into some of these numbers that we have. I've got a whole list in front of me here. I know you do too, but we've got so many great questions. It's hard to, ignore those. And I know that we wanted again to get in these numbers, but these questions are just important. So one of the questions here that we had about the ADPH dashboard is saying, look, when I looked the other day, the numbers are the same. Why are they the same today as they were maybe on Friday? So can you just kind of quickly explain that the dashboard is not updated in real time?
No. Oh, no. I mean, anything that depends on human input is never going to be 100% accurate. It is, and that's not ADPH. That's just the way life is. There's always been a delay in when information was reported. And throughout this pandemic, we would see data dumps, and they would generally say on their site, this, we're reporting 5,000 new cases, but this dates back 3 months. So you do that. Now, what we've run into lately is there will be days where the health department doesn't report case data. And life happens. But when you're watching it, it makes it very difficult. And I'll get an email that says, why didn't you report today's number? Well, today's increase. Well, if I don't have yesterday's increase reporting today's increase, it doesn't work that way. And I don't like to do 2 days lumped together, because then it artificially inflates. I don't want to report we added 6,000 cases, because people don't read in 2 days. They just see we added 6,000 cases. Mm-hmm. But there's always been a delay. There will always be a delay, and the numbers are not 100% accurate. I get a lot of questions about if I test positive, not if I pass away, but if someone passes away in a different state. Again, we have people that, they go to seek treatment in a different state. Where do I count? Where does my number show up? And eventually you will probably show up in Alabama, but not initially. You will show up in that other state's numbers. And that's just what happens.
Right. Looking to some of these questions, Brittany says she and her husband tested positive, I believe she said, for COVID yesterday. We're thinking about you, Brittany. And her question, though, she's still asking about this, the sequencing and how do you know if you have Delta? So, Brittany, here's the kind of basics of it. If you go get tested, they're going to tell you if you're positive for coronavirus, that your test shows that. And then your test, there's no test for you to determine if you have Delta variant. Yeah. There is a test for experts, and experts meaning people who are experts in virology. If I can say, I can't say that. Who are experts in this type of field, who are medical experts. They take those cases, they sequence them, and then they determine, okay, 80% of Alabama's cases are the Delta variant. So while they might not take every single case and sequence them individually, they take enough to make a sample size, and then they look at the percentage there. So the thing is, will you directly know if your case was Delta variant? No. At the end of the day, medical experts say that doesn't really matter for you. This matters for the public health side of it, but you and your doctors and your medical team will be treating it in the same way. So it doesn't really matter as much for you. I understand you're curious. I would be curious as well. I would want to know, but that's just not something that is happening at the same time.
Well, and, early on, and I say early on in the Delta variant, which was last month, there was some discussion about the symptoms may be different, and you're not seeing as much of the cough. You're seeing more nasal, sinusy. And I've heard incidentally from people that that's more what they're experiencing now. But the thing about COVID that we've had from the beginning is that the symptoms were so different. I had COVID in January, and I felt like I had a sinus infection for 1 day. and but somebody else down the road, may have had a horrible cough and all sorts of issues. So I'm not sure if we can totally use symptoms, but I do think it's interesting that anecdotally there does seem to appear to be different symptoms.
Right. And so again, Brittany, we're thinking of you and your husband. We're thinking of everybody here that has COVID, no matter the severity there. We're thinking of you, hoping you get better. So Lita, let's talk again about some of these numbers. We know we have 2,631 people in Alabama hospitalized for COVID. That is the latest number we have. Now compare that to July 17th. So that was 1 month ago. And that was just 429 patients.
And that was high. Yes, that was high. Yeah.
And that was high. And I'm not good at math, but that's a big increase, 429 to 2,631. Now, I had a question early on about Children's Hospital. So I'm pulling it up here on my phone. This is from Children's Hospital located in Birmingham. This is not to say these are the only children. This is just the one hospital. They provided an update last week. As of last week, they were treating 22 COVID positive inpatients, and 5 of those people were on ventilators. When I say people, I mean kids. So 22 kids were being hospitalized for COVID-19 in this one hospital in Jefferson County last week. 5 were on ventilators. That was the latest update we had from Children's of Alabama.
Yeah. And I don't get a lot on pediatric cases being broken out. Huntsville has the Hospital for Women and Children, but they do report the total number there, but you don't know what is pediatric. You would assume most are pediatric there. I know last week when they did the update, Huntsville had 3 teenagers and a 10-month-old baby, 1 in ICU. We don't know, which one was in ICU, of course. But again, you definitely see that number, rising as opposed to what we saw. But I think there's a lot more attention on pediatric cases because of the fact that 12 and under can't be vaccinated. I mean, it's the law of averages. You're going to have, even if you only have 40% of the population vaccinated, and you have 100% of the population 12 and under not vaccinated, the simple law of averages is going to tell you where the cases are going to go,
Right. And let's talk about breakthrough cases as well. So the different hospitals, again, if you follow them on social media, they will tell you, and they've been doing a really good job at showing you the breakdown. I'm showing you one right now. It's a screenshot on my phone, and this is from UAB, and you can see outside of my light. This is how a lot of hospitals are doing it. So this was posted yesterday. UAB Medicine says that the current COVID hospitalizations in their hospitals is 181. And of those, 160 are vaccinated and 21 are unvaccinated. Let's back up. 160 are unvaccinated, 21 are vaccinated. I think I said that backwards, so excuse me there. But again, this is from UAB. You can follow them on social media. You can follow a lot of hospitals on social media, and they'll tell you that. So Lita, we know that the tracking of these breakthrough cases has been a little tricky. Again, with all of this data is tricky in general. But the latest that we have of breakthrough cases were as of August 11th, and we had 8,754 breakthrough cases. And of those, we didn't have a hospitalized number. You and I were able to kind of do the math looking at these different hospitals and decide it was between maybe 10 to 15% who were hospitalized. So can you kind of explain how you get those breakthrough numbers and how the trends of that have been working?
Yeah, ADPH is as of the 11th, they reported that 89,732 COVID cases since April 1st. So April 1st, we had, let's just round up for reporter math, 90,000. There were 8,754 breakthrough cases. Let's round up, make that 9,000. So you've got 10% of breakthrough cases. The great news about that is that's only 10%. And so if Alabama improves that vaccination number, you're looking at a much smaller percentage. Our hospitals would not be overrun right now. Now, we're never going to get to 100% vaccination. We know that. But you would be dealing with a lot less. What I am looking forward to, and what I am hoping and praying for, as we have that uptick in vaccinations, and then, more interest in vaccinations, more people coming out talking about it, that it's going to take us 2 to 3 weeks for that to show up, really about a month. And so we're hoping, if as the vaccination increases, that pool of hospitalizations hopefully will go down. What's also very interesting is we don't know in that 10% what comorbidities were there. We don't know, was it underlying issues that even though I'm vaccinated, my health was already compromised to the point where that vaccine may keep me alive, but I may still have to be in the hospital.
Well,
but overall, every number is 15% and below hospitalizations are vaccinated.
Well, and I just want to repeat those numbers because they're important. So 89,732 COVID cases since April, and this was numbers from last week. And so 87,000, we can say 87,000, we can write 89,000, we can round up to 90,000. It's in 87,732. Of those, 8,754 were breakthrough cases. So again, not good at math, that's 10%. So the chances there are still better to not get COVID, number one, but also not have a serious case of COVID if you are vaccinated.
And that's breakthrough cases. And I don't want people to get confused. That's breakthrough cases, not hospitalizations. So most people are reporting breakthrough cases as extremely mild. I wonder sometimes if we don't miss a large number of breakthrough cases simply because people don't know they have it. And that could very well be the case. So this is, when I read this, I was like, that's the best news I've seen in a long time, because it is very obvious that vaccine works. It's, and I heard a doctor talk this week and said, the vaccine's it's not necessarily designed to keep you from getting COVID. It's just to keep you from getting sick from COVID. And I'm like, well, that was pretty brilliant, So that's my medical rant of the day. So there you go.
Well, and two, I've got so many people who are talking about schools, their thoughts on their school districts here. And, it's important to note that the school districts are making their own decisions locally. There is no statewide rule about schools, whether they should have mask mandates or what they should be doing. It's really up to the local districts. We've been following all of that on AL.com through our Alabama Education Lab. That's where you're going to find all of that information. I understand it's a hot topic now, though. I don't have a child in school, but I can understand why that is so important. Lita, I want to quickly touch on something that we reported yesterday that got a lot of people up in arms, and that is some facts from the Alabama Hospital Association president, Dr. Don Williamson, and he said there's 2 net ICU beds left in the state.
Yeah.
Let's explain that quickly. Now, of that, there's 1,562 ICU beds in Alabama. There are 1,560 patients who need ICU care. So you subtract the patients who need ICU care from the number of ICU beds, and that's how you come up with the number 2. So can you walk us through that a little bit? I know that that's scary. People I know got that push alert and they said, oh my goodness, that is scary. What is happening?
Yes, it doesn't mean that if you take every ICU bed in the state that there are 2 and they're in Jackson County. That's not what it means. They look at that as a pool overall. And you also have, so you've got this number. So one hospital may have every ICU bed empty. I doubt it at this point, but let's say they do. One hospital might have every ICU bed empty, but one hospital might have been so full that they're having to move these ICU patients into a different area because it's not uniformly distributed. And where we run into issues in Alabama with that is, if I'm in Birmingham, my access to care, or if I'm in Huntsville or Mobile, my access to care is a lot different than someone in Clark County or Greene County. We have, and that's not just Alabama, that's most of our country. We have healthcare deserts, just like we have food deserts. And so your access to care would be different because you may be in a place where the ICU beds are full. And of course, an ICU patient is going to require greater staffing, greater, attention. It strains. It's not just, oh my gosh, I got to put a body in a bed. It's, I got to have somebody to care for them. And, one of the things that I think will be fascinating as we look on is the cost of care since this pandemic started is just going to be, it's amazing, what our hospitals and what our government has spent. So that's where the ICU beds are an indicator that we have, again, cases go up, hospitalizations go up, ICU go up, and unfortunately then deaths go up. That is the pattern we have seen. And that's the pattern you see with any disease.
Well, and again, it bears repeating, 1,562 ICU beds, but there are 1,560 patients needing ICU care. So whether or not you look at the bed number, that's a lot of people needing ICU care. We know too, you look at those numbers, 2,631 people hospitalized with COVID. So the numbers don't lie. These numbers are facts. They are coming from the state. They are coming from numbers
from
that the hospitals
are
reporting.
Let's say that I think, okay, I look at that number and I'm like, okay, we have a lot of COVID patients. Well, what if I have a heart attack and I need ICU care? If you say, oh, we've got enough beds, we have 2 extra. That means that other people needing other acute care may not have the same access because we've got, we're filled up in other areas. Yeah. The whole thing of this was to not strain the healthcare system, and that's what we heard. We had to get supplies there, and so now we're not hearing supplies; we're hearing space and personnel.
Right. That's a good point, Lita. This talk about ICU beds, this talk about hospitals is not necessarily a complete COVID conversation. It's just about people needing care, whether that's for car accidents, heart attacks, other types of health conditions. So Lita, I know we could talk all day about this. We won't, but we could. So I'm going to just quickly say, if you have questions about what we talked about here today, you can email myself or Lita. My email is iHerinQ@AL.com. I'll type it out so you don't have to spell it. And Lita's is a lot easier. It's AL.com. You can email us directly. You also, if you have a question about vaccines, you can email our account, which is vaccines, VACCINES, so plural, at AL.com. We are taking those questions and pairing them with the correct medical experts, public health experts, vaccine experts, and getting experts to answer your questions there. So questions can come to me, Lita, or the general vaccines at AL.com email address, and we'll get them answered. So Lita, thank you so much for keeping us updated on this. I know that you've learned way more about viruses than you would have ever liked to know, and way more about data than you would ever like to know. Yes. I'm just a history major from Montevallo's. The joke here has always been that I don't do math, but unfortunately, I've had to do a little bit more math than I would like to recently. So let's try to get to a spot where you aren't turning Lita and I into mathematicians. So please. Yes. Yeah. Absolutely. Lita, thank you so much. Everybody watching, thank you again. You know where those questions should go. And everybody have a great day. Please be nice to each other, especially here in the comments, and we will see you tomorrow.